Hi everyone, Dr. Omi from Pain Free and Fit and Posture Size. Today we're going to be going over how to safely train your upper pecs, your chest, with incline pressing without aggravating your lower back disc problems. Hope you enjoy. So whether you have disc problems in your lower back due to degeneration, bulging discs, or herniated discs, incline pressing can many times aggravate lower back pain because, as opposed to a flat bench, when we're on an incline, similar to shoulder pressing, our spines are more weight-bearing. When we're on a bench and we're flat, spine is usually not weight-bearing. We can even position the difference height of our feet in terms of being up to flatten the back a little bit or bringing them down a little lower to arch the back, depending on your unique needs and your RPI. Your RPI, or reverse posture isometric, is essential to incline press or do any exercise. You need to put your spine in a neutral spine position, meaning it's the tailored position for you that corrects all your unique posture movement tendencies. We all have a tendency to raise one hip up, to turn our bodies to one side, to have one muscle in balance with another. Any kind of long-standing lower back pain, we have these asymmetries in our body. And when under load and trying to eke out the last few reps with our workouts, we're going to go into our strengths, our distortions. If trying to get that last couple reps out, you need to put a little extra into your body with your core, you're going to have a tendency to pull that hip up, to twist a little bit, to use those muscles asymmetrically around your core, and that stresses your spinal segments, stressing your disc problem. So you want to learn what your unique RPI is. If you don't know what that is, go to the Posture Size or PainFreeandFit.com website, check out our free body analysis, learn how to position a tailor-fitted unique position or a neutral spine position for your lower back so you can hold that with this or any exercise. That being said, it's always easier to use a bar when incline pressing with disc problems because the bar is set in a rack. You can lean back. You don't have to throw the weight up to get in a position. But for demonstration purposes today, I'm just going to use some light dumbbells. So here's the drill. When we get into a position for incline pressing, whether we're using a pronated grip, a parallel grip, or even a reverse grip, the key is the further my hips are from my back, meaning that way, it's going to flatten me out. Now, it's not going to target my upper chest as much, but it's going to be safer on my lower back. The closer in my hips are, all the way back in the bench, the more vertical compression on my discs. That's going to be a little bit more dangerous with the disc because, as we know, discs get aggravated with compression and flexion or bending forward. So one technique you can use right out of the gate is that if you feel your lower back in a position on an incline press, is to just shift your hips a little more forward. Sometimes a ½ inch to an inch is just enough to create a little more arch in your back, flatten it, create a little less weight-bearing compression on the spine, vertical compression, more of a horizontal like a normal bench press, and then you go through your incline pressing from that position. Your other option is from this position is using your upper back. Now your upper back between your shoulder blades is the contact point for any type of incline pressing, and many people don't emphasize that enough. So when you're in a position like this, and let's say you're in a bench, let's say that has a post that you can slide down and you start to feel your lower back a little bit, simply by leaning your chest upwards, meaning I'm trying to take my collarbone and lift it towards my chin, that motion in your chest benefits you two different ways. Number one, it puts a little more weight-bearing pressure between your shoulder blades into the bench than the lower back. And two, it creates a mechanical target for the upper pec, which is what you're trying to target with incline pressing. When our collarbone dips down, we're going to use more of our middle pec, less of our upper pec. When we lift the collarbone up at that same angle, we're going to recruit more of those upper pectoral fibers. And you'll feel the difference in your contact point against the bench. In a normal contact point, I feel a certain amount of pressure between my shoulder blades and the bench. But when I lift that collarbone towards my chin, you notice I drive more weight-bearing pressure in my upper back. That alleviates the pressure on my lower back, making it easier to do those incline presses without compressing and irritating my degenerative, bulging, or herniated disc problem. If you like this video on upper chest incline press training with disc problems, feel free to subscribe to our channel. We've got a lot of great videos out there to help you along on lower back, disc problems. Questions or comments, write in. As always, I do my best to answer them. Thumbs up below to help me share this valuable information with a lot of other people that are looking to work out with disc problems and are not sure how to do it safely. And if you're looking for a custom-made program to tailor exercises, rehab, learn how to work out without hurting your disc problems, check out our fast track program for degenerative discs, herniated discs, and bulging discs at the painfreeandfit.com website. It's got all your body analysis to learn how to position yourself and learn what your unique neutral spine is to safely exercise and get into fitness without hurting your lower back. How to use the supportive stabilizing exercises to target your unique muscular deficiencies, your muscular imbalances. Just normal tear sheet generic exercises usually don't do it for people with disc problems. You need tailored exercises to specifically address your unique needs, your unique weaknesses. Certain exercises target certain muscles and problems, other exercises target other alignment, postural stability issues. So you need to really plug in and match up a tailored program for your problem. That allows you to get back into the gym, working out heavy without hurting your lower back. I hope this particular program on incline pressing for disc problems helps you with your fitness goals and lower back problems.